We have seen them and they are there, but it's not a win-win. No one wins. Everybody sticks to his medical school philosophy. But to make it good, we have to have a research-based evidence to show that medical school is better than the other medical school. Now, in the world of artificial intelligence, we will face many problems regarding to the student assessment, you know? We'll face it. So now, how we can reach to the agreement? This is not a problem of Africa, it's a problem of worldwide. Now there is a fallout everywhere. The fallout is everywhere. The quality is deteriorating everywhere. So how can we get it back? That is my question. Thank you very much.
Okay, so I'll invite any of the speakers if you would like to respond to that question. And you can use your microphones at your seat.
Shall I add more question?
Yeah.
Mais, excusez-moi, s'il vous permettez, est-ce qu'on ne va pas prendre les questions et après on va répondre puisqu'on est un peu en retard, ce que j'ai compris, un peu, ou bien on va répondre au fur et à mesure que qu'est-ce que vous pensez? Est-ce qu'il faut prendre les autres intervenants avant de commencer à répondre? Do you understand?
Yes.
Okay.
Yes. Okay. Yeah, my concern was that for time, I'm not sure then that we would have time to answer them. So I think if we could answer each question as we go. You want together? Okay. We'll go to the next question.
Okay. Thank you very much. Just 3 presenters already we have gotten certain very important innovative ideas in concerning with medical education. I really appreciate for the presentation. But I have one concern with the middle one. I think, Doctor, sorry by not naming your name actually, where I'm not perfect enough. So in medical education training, we have a lot of modalities we are using in different schools. Basically, the interactive way of teaching model is the most important in our case for medical students. We can categorize both in class, in labs, and bedside teaching. These are the most important pillars for medical education as far as we have done so far. The most important thing now, currently, the technology has suffering as basically for student assessment, which is most important for me, according to presentation. We already have using that pre-class assessment for assignments. Okay, for lecturing or for class assessment for quiz may be applicable. But in case of clinical assessment, how far we are going to use, to exclude students to use AI to manage such kind of case in case of practical assessment. So is there anything which is innovative idea or innovative models can tackle the involvement of AI in medical education further? Thank you.
I think we have time for one more question, and I want to make sure that we have an opportunity for our presenters to respond. So we can take one more question, and then I'll give each of our speakers an opportunity to answer. Yes, I think in the front we have a question here that was, he had raised his hand early on. If we could bring a microphone to the gentleman in the front.
Okay, thank you. My name is Dr. Abdinasir Wako. I'm from Adama Hospital Medical College, Ethiopia. So my question is for second presenter. Thank you, it is very nice presentation. As you know, the medical curriculum is very old. It's almost for 1 century it has been there. We are using Western medical curriculum. It usually divides basic science and clinical science. So you are putting One Health, Global Health under basic science, teaching under basic science. Is it better if you add the third pillar, like basic science, clinical science? What if you add the third pillar, which focus on system science, in which we incorporate One Health, Global Health, local systems, including teaching our students about leadership, about local systems. Most of us, we know about disease only. We learn disease during our attachment and basics. So the drawback of this old curriculum is only disease-oriented. It forgets public health aspects. So to integrate all this, what if we consider the third pillar? Basic science, clinical science, the third one as system science, in which you teach our students about African system, African problems, including some global problems, and even One Health. What if we put us as together and teach our students to learn about ourselves, about leadership, about skills, about problem facing health center in each parts of Africa. Thank you.
Okay, thank you. So I think perhaps would Dr. Riza like to respond first?
Yeah, thank you very much, colleagues. And these are very interesting questions and comments. So I will respond to some, and my colleagues can add on where necessary. So let me start with the last one from our friend from here. So I think we all agree that all those pillars are very important, but now how to deliver them becomes the question. For us, we are very passionate about integration, so that we don't look at these topics as if they are segmented. So that's why our students graduate with both a degree in medicine, but they also get a master's in global health delivery, which is integrated in the program across the basic medical sciences, all through up to the clinical phase. So I think for that reason, this is why I would think it becomes more interesting if students look at these as if they are not looking at the basic science away from the global health, for example. So that's why we thought about that approach. Maybe there can be discussions again to see how to, if there is need for improvement on that. Then in terms of, I can also comment about the clinical assessment. I think the best person would be my colleague, Dr. Natalie, to speak about that. But from the basic science aspects, I think AI is good. It's good for students to use it. We cannot run away from it. And like Professor Zohari mentioned clearly, the next generation definitely will be using AI for most of the solutions. But if it's for purposes of knowledge, for the cognitive part in the basic medical sciences, we think that the students should still refer to the textbooks and get much more information than just getting a summarized version. So maybe as they get along and understand AI even better, they might find it more interesting even in getting a broader picture of information than how they use it at the moment. Because again, from the review that we did, we found that students consider basic medical sciences as just a step to get grades and progress, not necessarily as an application into the field of clinical medicine. So I think that's still a discussion. We still want to see how to integrate artificial intelligence even in the biomedical sciences. And maybe before my colleagues, let me also touch a bit on the traditional versus the integrated curriculum. again, I've also discussed with many of my colleagues, there is a debate that I don't think I can be the best person to answer which one is better, but there is a lot of evidence so far that suggests that students are able to learn better when they are actively involved and when they look at a system as a whole. Instead of studying anatomy, then go to physiology, and then, so if they study these, they can look at the body structure, then look at the function, look at the pathologies in the whole system together. And I thought that part of integration has been documented to be favorable, but again, like I said, there has been a lot of other, of course, benefits and challenges in each model. I don't think there is one model that would be the best, in my view. We can borrow the benefits in each and see if they can be if we can apply those benefits rather than thinking one is better than the other, in my opinion. Otherwise, thank you for your questions. I can ask if any of my colleagues wants to add.
Oui, merci beaucoup, docteur. Je pense que ça a été, merci en tout cas pour l'intérêt que les uns et les autres ont eu sur nos présentations. Et moi, d'emblée, je dirais que la science, elle est vraiment universelle. Là. On est parti, elle est universelle. Et la formation médicale l'est aussi. Moi, j'ai la ferme conviction, et quand je prends ma spécialité en tant que chirurgien, que ma lecture, probablement concernant par exemple un cancer du côlon, elle est presque la même lecture que les chirurgiens qui se trouvent ici ou ailleurs. Ce que je vois, on n'a pas à opposer la méthode traditionnelle avec l'avancée technologique. Non, c'est complémentaire. Les systèmes anciens prennent comme atout l'avancée technologique. Donc, on améliore ce qu'on avait l'habitude de faire avant, que ce soit par rapport à la formation clinique et les sciences de base. Aujourd'hui, on améliore en utilisant la technologie moderne, l'intelligence artificielle. Donc, à mon avis, le consensus ne doit pas être difficile si on s'entend sur le fait que la science médicale est une science qui est universelle et que plus ou moins l'essentiel doit être accepté par tous pour qu'on avance ensemble. Donc c'est vraiment ça que je voulais dire, et que le consensus est bien possible. On n'a même pas besoin de consensus. Il faut appliquer les sciences de base, il faut appliquer ce qui est universel, et les particularités, naturellement, viennent en fonction des pays, en fonction du milieu. Telle maladie est présente dans tel pays, on va se focaliser dans les curricula à développer cette maladie, mais ça ne veut pas dire que les schémas, les grands schémas de la formation médicale s'opposent. Voilà un peu ce que je pourrais dire par rapport à la présentation. Merci beaucoup.
Thank you. And to Dr. Tan.
Thank you very much. I just wanted to make a couple of comments about AI and clinical assessment. Clinical assessment, I think, is where the student really is face-to-face in a real-life situation with a patient or a simulated patient in front of an examiner. And so AI is great for summarizing, for finding information, but there's 5 C's which AI cannot do at this stage: creativity, critical appraisal, communication, coordination of care, compassion. And so clinical assessment will be testing our students on those 5 qualities. And I think in the future, we use a lot of OSCE examinations, which I'm sure you're all familiar with, but maybe the student will be asked to analyze an AI-generated management plan for a patient in an OSCE station, and then apply that management plan to the patient, contextualized, communicated well, showing much compassion and empathy to that patient. So yeah, the train has already left and we're running to catch up, as one of the speakers said earlier today.
So thank you. I'd like to have a round of applause for our 3 presenters. And I know that there were some questions that we did not have a time to answer during the session. So please, if you have questions, I do welcome you after the session to come up and speak directly to the presenters. Just a reminder, so you have been given bracelets. If you have the red or orange bracelet, then lunch is across the way at the older building downstairs. If you have the blue bracelet, then lunch is outside the hall here at SkyTrain. And then lunch will be 1 hour from 1:40 to 2:40. And the plenary session will begin at 2:40 here in this room. So thank you very much. We appreciate your attention and look forward to seeing you back at the next plenary.